avoid a hysterectomy and even still have children. So we went to talk with some of the doctors about this amazing procedure.
All right.
I went to a normal OBGYN visit, annual visit, and just mentioned to my doctor that I was experiencing slightly heavier bleeding than I had in the past several years. And during the normal exam, he said that I believe you have fibroids, but we'll do a biopsy, we'll do further exam to be sure. And through all of that, we discovered that, in fact, they were fibroids. So I asked him at that point, so what do we do? And he said they're benign. There's nothing to be concerned about as long as your symptoms are manageable. You're going to tell me if you need treatment.
Louisa Buckler knew something needed to be done, but she wasn't sure a hysterectomy was the right choice for her.
It's almost like someone had flipped a switch. It became very excessive very suddenly, so I went back to the doctor. We spoke about options, and a myomectomy was presented, hysterectomy, and then there was a third procedure, and I don't remember the name of it, but they were all pretty drastic.
Dr. John Greene, the Associate Director of Women's Health at Hartford Hospital, says many women are in their 30s and 40s and have similar symptoms.
Fibroids are benign tumors that grow in the uterus. They grow within the muscle wall, probably starting from one cell that grows, and they grow at different rates, and they can get very large. The predominant symptoms for women are bleeding, or sometimes they grow to the point where women feel this bulk or this heaviness in their abdomen. Very, very common tumors. They occur in about 40% of women.
At Hartford Hospital, doctors are working together to help women and treat them without invasive surgery. Instead, they're using something called embolization. Dr. Greene says this procedure is used after trying the medicinal route.
If they do have symptoms, we'll often try medical therapies first, such as progesterone or birth control pills to control the bleeding. However, if medical therapies don't work, then we want to do something more definitive. One of the new options is interventional radiologists like Dr. Hallisey can then embolize the fibroids. And that's done as an outpatient procedure with basically minimally invasive surgery.
Uterine fibroid embolization is actually a very old technique. For 30 years now, we use it for emergency bleeding or life-threatening bleeding after trauma or after surgery. However, we found that certain women who are heading for surgery like hysterectomy or myomectomy would be at risk for bleeding after their surgery. And so we started to perform embolization prior to those surgeries. Embolization means blocking up of a blood vessel. The goal was to stop the bleeding that they might experience in the surgery or after the surgery. But we were surprised to find was that women started canceling their surgery. When they canceled their surgery, it was because their symptoms were getting better. These fibroids are benign, but they cause unpleasant symptoms. And so many women were canceling their surgery that they started to seek this out as a primary treatment for the uterine fibroids.
The best part about this procedure is the recovery time. Some patients are back on their feet as soon as the next day. An average woman needs about 4 days of rest.
I went in as an outpatient, had the procedure early in the morning, and was told that I would have to remain in the hospital just for that one day, for about an 8-hour period, and that I was warned that there could be painful side effects as the fibroids were losing their blood supply. I actually had tremendous results. I had no pain whatsoever. I had a little bit of cramping a couple of days later. I had the procedure done on a Friday. I was back to work on Monday.
Wow, so that's a big ringing endorsement there. Now, not all women who have been treated with fibroid embolization can have children after. It really depends, and you'll have to talk to your doctor. And what's nice about them is they have this team where the gynecologist and the radiologist work together and really follow you. So all the information, check on our website and check out Hartford Hospital. Their quality of life, yeah, even and especially if the symptoms go away and you can live a normal life.
Very good.
We'll be right back.